Hey, Gerald 508, how are you? So this is our final biology component, but in a really important biology component, and this is the psychoneuroimmunology section. And this concept of um, our brains and activity within our brains that we see during stress, but also during different interventions that we can take to reduce stress, like meditation and Tai Chi and exercise and things like this. How that the discharge of the nervous system um, can reduce our overall inflammatory response and really train our immune system to be better off. Um, Alternatively, we can see that under conditions of chronic stress, we enter into a chronic inflammatory state um, that is another contributor to the metabolic syndrome that we see with diabetes. Vascular disease, a big part of vascular disease um, is inflammation, and then um, also this impacts things like wound healing. Um, it impacts things like autoimmune disease, and especially for the women in the classroom, where there is a really large gender bias in terms of autoimmunity, roughly across the board. If we look at all the autoimmune diseases, it's around 6 to 1. And then some diseases are far higher, like Hashimoto's and Sjogren's disease. Okay, so alrighty. So what I'm going to do is I'm going to go ahead. I'm going to jump in to the readings, okay, and then we're going to relate this back to the discussion. Sorry. And what I want to do is I'm just going to focus on psychoneuroimmunology. So we're going to jump into the readings right now, and we see that uh, for this week, okay, the week of July 9th, psychoneuroimmunology is the topic. We also have um, uh, uh, the first major arena of intervention to reduce um, diseases associated with dysfunction in the mind-body connection. And we're going to talk about the importance of sociality. I'm going to do a separate video on this, and because it's so important, and it'll be short as well. So we're going to jump into the psychoneuroimmunology video. Again, this is pretty intense biology. I will freely admit that there are so many aspects of these articles that I am not expert in. I don't understand, and that's okay. Okay, I just want you guys to read through these, and just get a feeling for the general concepts, and that's the most important thing that you can do. Okay, alrighty. So, and I kind of spell things out right here in terms of my dialogue. So what I did is I kind of went through the articles and I discussed kind of the most important things. Okay, so read through what I said here. I'm not going to get into it I'm not going to reread these right now. But the concept of this automatic or autonomic nervous system. Okay, the stress one we've already talked about, the fight or flight. So we have an adrenaline rush coupled with release of cortisol. And then we have when we are just cooling our jets, okay? And it's the parasympathetic response, okay? Which is also coined the rest and digest, okay? So what you do when you're eating and you're being very protected, you feel great about yourself, okay? All right, and there's contrasting effects on these two. So what we'll do is we can just jump into these two articles right here. And this is looking at nervous system modulation of immune function, okay? So we can jump into that right here. And again, it talks about how chronic stress and activation of this fight or flight response can cause this process of elevated inflammatory cytokines. These are messengers that our immune system puts out there for us. Okay, so you just kind of read through. Um, this is the abstract, and you guys are familiar with doing your paper. They talk right here about a transcription factor pathway. What that means, okay, is that um, when you are in an inflammatory state, for example, you just got yourself a viral infection, you just got yourself a bacterial infection, okay? So we need to sound the alarm to let the immune system know that there is a challenge going on, and it's going to impact our health. It could kill us, okay? And so that's the role of this inflammatory response, okay? So what we need to do is set into motion a really active immune system, okay? And it starts with sending out all of these chemicals, these hormones, so to speak, of the immune system called cytokines or lymphokines that immune system cells and other cells will release, and that activates all the immune system to rush to that site where they're being released. They're kind of like bloodhounds, and they'll sniff out the source, okay? So if I have an infection right here in my arm, the concentration of cytokines will be greatest here, and the immune system cells will run up here and gather up there and fight the infection, okay? It doesn't matter where the infection is. This is also true of wound healing as well, okay? All right, so this transcription pathway, okay, what it means is within your immune system cells, in order to activate them, we need to have them produce these messages, okay? And so the recipe for producing these messages is in the nucleus, in the DNA. Remember all the cookbook, we talked about it when we went over the epigenome, okay, and methylation and all that kind of stuff, okay? So this is a key chapter in our cookbook, and that's how to make these inflammatory messengers. There's two classes. There's an anti-inflammatory and a pro-inflammatory, okay? And this is the way the immune system works, okay? So the key permissive factor that goes to the DNA and starts reading all these recipes so that you can produce all these cytokines is called this NF-kappa B, nuclear factor kappa B. So it's a pathway that gets activated that it says, let's transcribe. And what we're going to transcribe is a bunch of pro-inflammatory cytokines, okay? Now, some of you, for example, may be taking drugs for arthritis or irritable bowel disease, okay? Crohn's disease. These drugs are called Humira, Enbrel. What you're doing is you're blocking these inflammatory cytokines because they're abnormally being produced, and that's why you have autoimmunity. Okay, so this goes through, and you just look at each of the titles here. Okay, so chronic stress leads to a downregulation of pro-inflammatory cytokines. Okay, so this is kind of an immediate effect. All right, the bad news about that, okay, is that you're wide open for infection. So you need to have inflammation. Okay. If you have tons of infections, okay, it can then turn on you, and you can then go switch from a anti-inflammatory to a pro-inflammatory state. And that's what we see, okay? So just know that stress is modulating this, okay? So we can see this right here, okay? So this is our brain. We're perceiving the stress, and we have these two different pathways right here. That is our stress pathways. This is the rest and digest pathway, and this is the fight or flight pathway. Okay, and this right here is what we learned about. That's also very important for releasing cortisol. Okay, alrighty. So here's the glucocorticoids. Here are the catecholamines that are part of the fight or flight response to the sympathetic nervous system. Okay, so we have this this transition that goes through, and here's the NF-kappa B that I was talking about. Okay, so these hormones then cause a change in the transcription level of certain messengers that the immune system use. Okay, so we have pro-inflammatory cytokines and anti-inflammatory cytokines, and it just all depends on the state of the disease, and that's all you kind of have to need to know. Now, what we see down here in this pathway is that yes, during an acute stress, you actually reduce your inflammation state. That's why I'm sure some of you have had arthritis, and what do when the Advil or ibuprofen, which is called a non-steroidal anti-inflammatory drug, when that's not working anymore, oftentimes they will do a direct injection of cortisol into your inflamed joint when you have arthritis, okay? And what that does is that reduces the cytokines temporarily, okay? And it creates kind of an anti-inflammatory state, which is good. It reduces the swelling, and that's where it feels so good, okay? However, with chronic stress, the system gets fatigued, okay? You get a resistance to these effects right here, and you see this increase in inflammation. So it says right here, inflammation-related transcription pathways, okay, are hyperactivated. And you see as you get chronic stress, you get into this pro-inflammatory state, okay, and reduced anti-inflammatory state. And this is thought to contribute this aspect of function to aging, depression. This goes up to the brain and affects the neurochemistry of our brain. It increases autoimmune disease, okay, increases vascular disease. Vascular disease is an inflammatory state. There are many forms of cancer that are based on inflammation. I'm sure some of you may even know, have friends that have had breast cancer, and one of the worst types of breast cancer you can get is what's called inflammatory breast cancer, okay, osteoporosis and diabetes. All right, so again, just kind of read through this and just take it in. Don't stress out about it, okay? All right, so then we come in here, and this is the next article, okay? And so it takes it to the next level, all right? And so again, it's talking about the inflammatory signal, okay? And these are different proteins that are important. Don't worry about them, okay? We have this nuclear factor kappa B that I talked about, okay? And it shows you right here that psychosocial stress, okay? Bad diet, obesity, and inflammation in the gut or a leaky gut, okay, can create an imbalance in terms of your regulatory and pro-inflammatory T cells. These are T cells of the immune system that increase overall inflammation, okay? And so these are the key elements called cytokines. These are cellular inflammatory messengers that an imbalance can occur under those states, all right? So again, we're looking here now. We've talked about the basics. Now we're going into a mind state, okay? So we see patients with major depression show increased biomarkers of inflammation. So that's called epidemiology, guys. So you sample a bunch of people, you rate, as you guys did in many of your papers, where they are on depression scales, and then you can do a blood analysis for, the most common one is we see right down here is CRP, okay? And when you have a CRP level greater than 3 milligrams per liter, you're considered to be in a pro-inflammatory state, okay? Just a little background, my wife has profound autoimmunity, and this probably contributed to her development of cancer. And when she was in her 30s, her CRP level was found to be 7.5 instead of 3. Okay, so it created a really, really bad scenario in terms of what's going on for her. Okay, all righty. We look at stress, how stress increases inflammation. This has been seen over and over and over again. And then we see some of the mechanisms, okay, of the cytokine effects on the brain. So now we went stress to immune system and elevation of these immune system hormones, and then we can see how these things then feed back to the brain and create, again, a bad situation. And this is what's shown right here in these two slides, okay? So this is blood going into the brain, okay? So yes, we need a little bit of stress to do good things, okay? So that's what the initial effect of glucocorticoids shown right here. But then we see down here with chronic stress that we transition into a pro-inflammatory state, and that's what this is all about here. And these are activated brain immune system cells that cause major problems. Again, we see right here, as you see this compound right here, TNF-alpha. TNF-alpha is the compound that is targeted by the drug Humira or Enbrel, okay? What Humira is, what Enbrel is it's an antibody that attaches to TNF alpha and keeps it from doing this, okay? So yes, you get rid of this inflammation of your nervous system, okay? Good for depression, good for multiple sclerosis, good for whatever autoimmune disease we're kind of looking at, okay? But bad because we need to have TNF alpha released when we're having an infection. So a side effect of these drugs, Humira and Enbrel, is that you don't have this signal, and as a result, you're much more prone to getting infections, okay? All right. Tryptophan is used to synthesize serotonin in the brain. Okay, sorry that the whole thing lit up there. There it is right there. Okay, so when we have lots of cytokines, the tryptophan is consumed out in the periphery by our immune system cell called a macrophage. Okay, and it transitions it or transforms it into a toxin that affects brain function. It's going to affect your cognition, as we see here, and also set you up for all these problems that are associated with Alzheimer's disease, amyotrophic lateral sclerosis, and Parkinson's disease. This is a neurodegenerative scenario that we see here. Okay. Very good. Okay. That just kind of goes over a little bit of this concept. Remember the folic acid and this state, we're looking at kind of methylation. I wouldn't worry about that one right there. Okay. And then we're going to get back over here. So we've talked a lot about obesity in this class. We've talked a lot about diet. Okay, we've talked about stressors in life, early psychosocial stressors. Remember the pecking order that we talked about. This right here gets into the gut, which is a new concept. Okay, so many people have inflammatory bowel disease. Okay, and that's what this is all about. And now we're also creating this concept of T cell dysfunction that is releasing all these cytokines. All these create this chronic inflammatory state that then leads to all these problems. Higher risk of cancer, higher risk of diabetes, higher risk of depression, getting back to the brain, and higher risk of cardiovascular disease. We're also going to see later on that it increases the risk of Alzheimer's disease. Yes, Alzheimer's disease is an inflammatory disease. Okay, all right. So that's the basics of that article, guys. Okay, so very cool. Just consume it. Okay, and then we see here we're looking at the inflammatory reset. So here I'm talking about again the inflammation process and all these diseases right here. So this is this last article. Again, these are complicated articles. I just want you to take in as much as you can and enjoy this, okay? All right, so it goes through all these things. Here it is again, TNF alpha, okay? There are drugs that are used to treat many different diseases, okay? So we can treat rheumatoid arthritis with an antibody for TNF alpha. Again, that's Humira or Enbrel, okay? They then track what we were talking about earlier, okay, in terms of the immune system and the nervous system. The sympathetic nervous system is pretty complicated, okay, and we'll see how that goes here. We have the rest and digest system that I was talking about right here, okay, so just kind of read through that, okay, and then we have the feedback that is this TNF alpha system, okay. When you have lots of pain, when we have an adrenaline rush, okay, you have this elevation of TNF alpha we see here. When we can have kind of rest and digest, then this cholinergic system, which is the parasympathetic system, is better for us, okay? It reduces the TNF alpha, okay? So you can kind of sift through that. I'm not going to read this article for you. What I want to show you here is a lot of us do practice alternative methods to medicine. And here's the basis for this, which is awesome. So this is complicated. You can look through this right here. Again, it's the activation of the acetylcholine system right here is going to reduce immune function, okay? Sympathetic nervous system can increase it, okay? It just all depends on the state. Initially, it can be inhibitory followed by excitatory. We see here that we have targeting of this anti-inflammatory cholinergic pathway using different types of feedback mechanisms, okay? So we can use conditioning, biofeedback, meditation, okay? We can look here at acupuncture, okay? We also have the psychoactive anti-inflammatory agents that are drugs. This is a new kid on the block, and this is vagus nerve stimulation, which is great, okay? So this, again, starts looking at interventions, and I just kind of want you guys to look at that. All right, so that is that article, okay? And then we end with another Sapolsky article, kind of provocative, which is fun, and it talks about how we are pro-inflammatory primates, okay? And it gets into the social status, okay, and inflammation. It talks about like a paradox, okay, and that is that chronic stress predisposes you towards inflammation. You're much more likely to get infections when you are chronically stressed, okay? Yet high concentrations of cortisol, corticoids, they acutely have a pro-inflammatory effect. I say acutely, but chronically, they have a pro-inflammatory. So you have an anti-inflammatory effect acutely, but chronically you go into this pro-inflammatory effect. And so it's, working out the mechanism right now. Okay, it gets into the human aspect of this, okay? And our social structure, how we have, as he indicates, invented the primates world's most corrosive form of subordination, and that's socioeconomic status. Low socioeconomic status, talked about here, causes increased risk of psychiatric disorders, telomere aging, and an increased inflammatory state. Awesome. Okay, so that's the essence of those readings. And then you're going to love this because they talk about the biology of this psychoneuroimmunology, both the immune system going to the affecting to the brain and the brain affecting the immune system, and many interventions. A short video, well worth it. Okay, so we start with meditation, as you see right here. Okay.
The Cousin Center is very interested in understanding the interactions between the brain, the body, and the immune system, and the science behind that, and generating rigorous scientific evidence about the efficacy of these approaches.
I think this center is one of the...
So I'm not going to watch the video for you, but you really got to watch this video. It's amazing. And then we can look at this one right here. And this is state-of-the-art psychoneuroimmunology, where they talk about studies. Okay, so we can look right here.
Wound, a 3.5 millimeter punch biopsy wound.
But what I can do is, like, for example, we'll go over here, and she starts talking about one thing, a study.
Foot ulcers currently, well, for most developed healthcare systems in developed countries, the approach tends to involve intensive podiatry-led treatment. So this involves debridement of the ulcer area, repeated changing of dressings, and patient education. But there are several reasons to believe, much like my argument with vaccinations, that our approach to dealing with this clinical problem is not yet optimal. The reasons for that are that if you look at the evidence, it's clear that 70% of these ulcers continue to be unhealed even after 5 months of specialist care in secondary care settings. Even when these ulcers are resolved, we know that 34% of patients will re-ulcerate within 12 months. And in terms of patient education, successive systematic reviews show that patient education is of absolutely no clinical benefit. So what can we do differently to try and improve the healthcare for this particular condition? And how does psychoneuroimmunology fit in? Well, again, I'd like to suggest to you that I think there are several reasons why PNI is wholly relevant here. Firstly, as I suggested in the context of vaccinations, we know that the immune system plays a pivotal role in the healing or the resolution of all sorts of wounds, including diabetic foot ulcers. So once again, what that means is that factors which can influence the effectiveness of the immune system will potentially impact on the body's ability to resolve wounds. As I've already mentioned to you, we know that psychological factors and emotional distress in particular is also able to dysregulate the immune system. And this has led to a huge amount of interest in whether or not psychological distress and related psychological factors might influence the rates at which wounds heal. And thus far, there's been a lot of interest in this area, but most of it's been experimental. And what I'd like to briefly do is just share with you details of the very first experimental study that was published in this area so that you can put the work that we've done into some sort of context. So
I'm going to leave it there. You can see how awesome this is, okay? So these are diabetic patients that have recurrent foot ulcers, and now they're looking at the interventions that reduce psychological stress and see if you can accelerate the healing process. So no medication, okay? Just good old-fashioned psychological intervention, okay? Coupled with antibiotics and things like that, okay? So really, really cool. Alrighty, guys. We then ask you to go into the discussion, okay? And then what you're going to do here is you're going to talk about your feelings about this concept of inflammation, brain function, okay, depression, how it's a vicious cycle, okay? Alrighty, in terms of the midterm, do not worry, it's open book, okay? Open course, it's only 30 questions, all multiple choice. You're going to do fine, okay? Alrighty, so we're going to end with that, and I'll see you later on during the week.